Welcome to Global Products MURX Doctor Training module video. Open www.murxtrain.us and log in with your user ID and password. Which will take you to the doctor or the physician panel. MURX can be navigated from the left hand navigation menu and also from these shortcut panels on the dashboard for quick access, such as scheduler, patient to consult, lab test result, patient for visit images, and refill prescription. We'll see how to navigate MURX using the left hand navigation menu. To expand the navigation menu, to show all sub options, click on the downward pointing arrowhead to expand the navigation menu and show all the sub options under the main heading option. Or to view the sub options for a particular main option such as patient clinical, click on the blue icon next to the main option. It will show the sub options under the main option. Similarly, for other options such as patient visit, patient chart, click on the blue icon on the left to show the sub options for each of these main option headings. Now, navigation from the shortcut panels. To view all self appointments, select the scheduler panel. It opens the scheduler and you can see all your self appointments for the day. Appointments for the week can be viewed by clicking on the week tab. You can view all your appointments for the week also. Select patient to consult to see the patients for whom the visit has been created. It shows the name of the patients under arrived and displays the appointment timing, name of the patient, and the age. To view lab results or reports uploaded in the software, select lab test result. It shows a listing of the lab results uploaded with information such as patient ID, patient name, the lab order code, the result, and you can mark them as viewed. Similarly, to see the images uploaded, select the images panel. Select refill prescriptions. To view the pending refill prescriptions, they will be shown in the list with the patient ID, patient name, the prescription, the order refill with an authorize button for the doctor to authorize the refill for the patient. To view patients scheduled for visit, select patient for visit. It displays the list of patients scheduled and a visit time. It displays the patient ID, patient name, provider the doctor name, the appointment time, and the status if the patient has arrived at the clinic or is scheduled to arrive. Recording or saving patient clinical data or information such as diagnosis, medications, printing prescriptions, uploading and markup of ophthalmic images in MURX is done in the patient chart. The patient chart can be accessed from the left hand navigation menu under the patient clinical option, and from also from the patient to consult shortcut panel. We will see how the patient chart can be accessed from the left hand navigation menu. Click on the blue icon next to patient clinical option. Click on patient chart. On clicking on the patient chart, it will open the patient chart section. Search list of patients arrived at the clinic for consultation for the present day, or the current day and date will show in the list below the search fields. It shows the patient ID, name of the patient, the encounter, the visit ID, age, gender, the visit date, which will be the current date, and the specialty, which will be ophthalmology. Click on the name of the patient in the list to open the patient chart for this particular patient to start consultation. This will open the patient chart. This is how the patient chart can be accessed from the left hand navigation menu. The search fields provided over here can be used or are used to view the patient chart for previous visits. For a clinic with more than one doctor, to see list of patients for a particular doctor, select the doctor name from the list of doctors by clicking on the search icon in the provider field. It shows the list of all doctors in the clinic. Click on the name of the doctor. You can select the specialty from the drop down list. For a single specialty clinic and a single doctor, the names and the specialty will be displayed by default. In the patient ID field, click on the search icon. A patient search window will open showing the complete list of registered patients in MEORX. Click on the name of the patient for whom the patient chart is to be viewed or accessed. To view previous patient charts or the visit history of the patient, it can be done by clicking on the calendar icon in the from date box. Select the date from which onwards the visit history is to be viewed. You can select the year, the month, date. To date will be the current date. Click on search. It will give a complete listing of all the patients who have visited the clinic and their patient records have been saved in MEORX from 2nd February 2010 to the present date, that is 6th of January 2018. To view their history, you can click on the name of the patient to open their patient charts. Click on refresh to go back to the current day and the patients arrived at the clinic for new consultation or a follow-up visit. This is how the patient chart can be accessed from the left-hand navigation menu. Now we will see how to access the patient chart from patient to consult shortcut panel. To go back to the main dashboard, click on the Start tab or close the patient chart tab by clicking on the close icon on the patient chart tab. This will take us back to the main dashboard. To access the patient chart from patient to consult shortcut panel, select patient to consult. On the dashboard, in the new patient to consult window, click on the patient name marked or displayed under arrived, which also shows the appointment time and the patient's age. Click on the name of the patient. To open the patient chart and to start consultation. The patient chart opens. The topmost part of the patient chart is the patient banner, which displays the patient information such as the name, age, gender, patient ID, address, his encounter ID, the specialty of the doctor. It also shows clinical information recorded during previous visits if it is a follow-up visit, such as diagnosis, medication, allergies. The next part of the patient chart is the encounter details. The encounter details are a checklist where the check boxes are automatically marked as the patient clinical information is saved or captured during the particular visit. It helps to check if any information is not captured during the visit. Vitals can be recorded in the patient chart. In the vitals section, it shows the recorded date and time. Enter the vitals in the boxes provided. Entering the weight, the BMI gets calculated. The temperature, the pulse. Click on save to save the vitals. Now previous vital history can be viewed by clicking on vital history. These are the vitals which were captured for this particular demo visit. Coming to recording or saving the chief complaints and examinations for ophthalmology. Chief complaints can be recorded by the doctor in free text format. Enter or type the chief complaint in the text box, or chief complaints can be selected from a list of chief complaints which have been incorporated or listed in MURX. Click on the search icon in the box next to the primary chief complaint. In the new window, select the first option, chief complaints. Click on the secondary chief complaints icon in the secondary chief complaints box to get a listing of the chief complaints. Click on the required chief complaint. A complete or a comprehensive listing of chief complaints is included in MURX. Click on the required chief complaint to select. Click on record in the chief complaints section to save the selections. Examinations for ophthalmology and corresponding findings can be selected similarly. Click on the search icon in the second primary chief complaints box below the first chief complaints box, wherein we selected chief complaints. Click on the search icon. In the window, select from the list of examinations. Examinations and their corresponding findings are listed in MURX. Select the examination. Click on the icon in the secondary chief complaints box next to the second primary chief complaints box, where we just selected the examination. For the findings for this examination, select from the corresponding findings for tonometry. Select from the list of findings. Click on record to save the selections. As you can see, as the vitals and chief complaints have been recorded, the checkboxes in the encounter details are getting tick marked as the patient data is being saved in the patient chart. Coming to recording visual acuity. To record visual acuity, click on the visual acuity link in the at the bottom right hand corner of the chief complaints box. There's a link for visual acuity. Click on the visual acuity link. On clicking at the bottom, two options will be visible: procedure notes and visual acuity. The visual acuity option will be selected by default. If not, click on the selection. Click on record new. In the new visual acuity window, in the visual acuity chart, enter the findings in the chart. And click on record to save. Now coming to the tabs in the patient chart. On the left hand side, just above procedure notes and visual acuity, is the face sheet. Click on the face sheet tab. The first in the list of tabs at the bottom. It gives a brief overview of the entire clinical information recorded previously as well as during the present current visit, such as diagnosis, along with the diagnosis history, medications, the medication list, allergies, list of allergies, and the encounter or the visit history for this patient. Since the demo visit is a new visit, As we enter and save the informations, those will be listed for this particular current visit. Allergies can be recorded in MEORX. To record allergies for the patient, click on the Allergies tab. It will open the Allergies section. To record a new allergy, click on Record New. In the Allergies window, select the allergy type. It says drug allergy, food allergy, miscellaneous. We select the drug allergy. Select the severity, the occurrence, location referred by allergy status, and select the allergen by clicking on the search icon. Since the allergy type is selected is a drug allergy, it will open the global drug database in MEORX. Can select the drug according to the ingredient, generic name, or the brand name. Select the drug. Enter the reactions, if any indications are there, in can be entered in a free text format. You can select the recorded date by clicking on the calendar icon and selecting the date as required. Click on record new to record the allergy. In this way, allergies can be recorded in MEORX. Now coming to the diagnosis section in MEORX, click on the diagnosis tab. To record diagnosis, select the diagnosis tab in the patient chart. It will open the diagnosis section. Click on record new. In the diagnosis window, click on the search icon in the diagnosis box. In the ICD-10 code window, search for the diagnosis by entering the search terms for the diagnosis required or to be recorded. For example, if we enter retina, it will give the entire listing of the diagnosis along with their ICD-10 codes mentioned. Or enter cataract to show a listing of the diagnosis for cataract. Select the diagnosis from the list by clicking on the diagnosis name. Click on the calendar icon in the onset date to select the date, the nature, status, diagnosis status, type, select the diagnosis type, such as whether it's admitting, final, inconclusive working. The date diagnosed can be selected by clicking on the calendar icon. Comments, if any, can be typed in free text format. Click on record to save the diagnosis. On saving the diagnosis, the recorded or the saved diagnosis will be displayed in the list in the diagnosis section or under the diagnosis tab with information such as the diagnosis, with the ICD-10 code, date diagnosed, type, onset date, status, resolve date, nature, and the name of the doctor. Now coming to the medication and the drug prescription section in MURX, click on the medication tab next to the diagnosis tab to select and prescribe medication. Click on record new. In the new medication window, select the linked diagnosis from the list. Now diagnosis recorded for the patient gets linked to the medication section. Click on the icon to select the diagnosis which was recorded earlier, and click on the search icon in the drug box to search the desired drug from the global drug database in MURX. You can enter the search for the drug according to the description. Searching for prednisolone acetate. It will give the listing of prednisolone acetate ophthalmic ointment. With the code and the description. Now, search for lepafenib. Click on the name of the drug to select the drug to be prescribed, and select frequency from the drop down list, the frequency of medication to be prescribed twice a day. Number of days, enter the number of days the medication is to be given. Select the start date from by clicking on the calendar icon. The quantity, enter the quantity and select the quantity from the drop down list. For a refill to be given, mark the checkbox if the refill is to be given and enter the refill quantity. If any substitutions are to be given, that can be selected. The dosage, enter the dosage in the box and select from the dosage. You can select the route. The stop date will get calculated according to the number of days and the start date. Instructions, if any, if are to be given, can be entered in free text format. After selecting the diagnosis, the drug, and the all the required fields, click on add update medication to list. The medication will get added to the list at the bottom of this window. It shows the name of the drug, dosage, frequency, start date, and the stop date. After adding and updating the medication to list, click on record to save the medication. Saved medication gets added to list in the main section of the medication tab, as can be seen. The information displayed is the RX number, the drug, quantity, frequency, start date, end date, and the status of medication if it is active. To print prescription for this medication, click on the RX number, which again opens the medication window. In the window, select the drug in the list, then click on print prescription. The prescription window will open. It will open a new window which can be printed or downloaded. It will show information such as name of the patient, his address, date of birth, the name of the doctor, patient ID, name of the medication, the date on which the medication has been prescribed, the dosage, and the quantity. To print the prescription, click on print. So you can print the prescription, or to download the prescription, click on download. Click on close to close the medication window. Lab or radiology orders can be placed through MEORX by selecting the orders tab next to the medication tab. Select the orders tab, click on record new. In the order window, select the order category if it is for a lab, procedure, or radiology. The name of the ordering provider will be displayed by default if it is a single doctor or a single specialty clinic, or you can select from the list of doctors for a multi-doctor clinic. Select the ordering lab if the clinic has a tie-up or the clinic has its own lab. Select the associated diagnosis, that is the diagnosis which was recorded for the patient during this particular visit previously. Next to order, click on the select orders link, which opens up a new window. In the order class, select the order class from the drop down list, such as blood bank, immunology, challenge test, chemistry. So for selecting blood bank, select or mark the checkbox for the particular test to be done. Click on OK. In the orders window, the order description is shown in the list with the order code. To select the order date, click on the calendar icon in the order date box and select the order date, and select the status if it is cancelled, completed, in process, or ordered. Click on record to save. In the orders tab, the order is shown in the main list. A printout can be given for the requisition form. Click on print, and a requisition form can be printed to be handed over to the patient. Again, it shows information such as name of the patient, his address, date of birth, and the order category, order code, order description, and the test date to be done. This requisition form can be printed by clicking on print, or it can be downloaded by clicking on download. In MERX, the images captured using ophthalmic imaging devices or cameras can be uploaded in this software. These images can also be marked and saved. To upload images, click on the Attachments tab next to the Orders tab. In the Attachments tab, click on Record New. In the Attachments window, select the image category from the drop down list. If it's anterior chamber A scan, corneal transparency, fundus, iris, orbit perimetry, select the image category, click on Upload Image, select from the image to be uploaded. It will give a small message box that the file has been uploaded successfully. And click on Save to save the image. The saved image is shown in the list in the Attachments tab with file name, the image category, a link to view the image, and a link to edit the image, that is, if any markup and text is to be added to the image. To mark the image and add text, click on the edit link. The image editor opens in a new tab. Click on the image to show the editing or and markup options. Select from the options to mark up the image. Click on the pencil. Select the size of the line markup to be done. You can mark up the image. Click on apply. If text is to be added, select the text option. You can drag it over here and enter the text. After entering the text, click on apply. Once the text and the markup has been applied, click on save to save the image. Close the window. So this is how the images can be uploaded and they can be marked up. Now coming to clinical notes, click on the clinical notes to record clinical observations using SOAP notes. Click on the clinical note tab next to Attachments tab. Select the SOAP notes template. Enter the information in subjective, objective, assessment and care plan. These are all free text boxes. You can enter the information by, you can type the information as required. After entering the information, click on record to save the SOAP note, and then click on sign to finalize. It will show a small window or a pop-up window which says notes cannot be edited after the sign. Click OK to proceed. The record will be saved and a clinical summary gets created at this part in MURX. Here's the clinical summary. To record procedure details carried out by the ophthalmologist, click on the procedure note tab next to the clinical note. Of the two options, select the procedure notes option. Click on the radio button to select the procedure notes option. Click on record new. In the window from the drop down list, select the procedure note. Now these procedure notes in MURX can be customized. These are all customizable procedure notes. Select from the list. As mentioned, these notes can be customized as required by the doctor. The format can be customized. Select cataract OT notes. This will show the fields in the procedure notes and the information that can be added. Consent forms can be uploaded in these procedure notes. You can select fields have been provided such as date of admission, date of surgery, date of discharge, name of the surgeon, whether it's a left, right eye. You can enter the details of anesthesia, findings, the procedure such as phacoemulsification with intraocular lens implant, prep and drape, surgical procedure details, post-operative medication, patient to recovery room comments and complications. After entering all the necessary information or typing in the necessary information for the procedure, click on record to save the procedure note. Click on sign. After saving the procedure note, similar to the clinical notes, a sign option will be seen in the top right hand corner. Click on sign to finalize the procedure notes. After signing the procedure notes, the notes cannot be edited. Click on OK. The record will be saved. Once the record is saved, there will be three options: print column 1, print column 2 and print column 3. If information is added only in the first column, select print column 1 and a report can be downloaded to be further printed out. So the procedure note can be downloaded and a printout taken. If the doctor needs to refer the patient to another physician or an ophthalmologist for referral purpose, select the referral tab in the patient chart next to procedure note. Click on record new. In the referral window, select the referral type if it is internal or external. Enter the first name of the doctor. His fax number, phone number, facility name, his last name, specialty, status. Click on save to save the referral. On saving the entered information, the referral note gets created in MURX, which gives the necessary information to be provided to the other physician, such as the name of the patient, his social history, allergies, his medications, the diagnosis with the ICD-10 code, if any orders have been completed, vital signs, encounter diagnosis, referral. To print the referral note, click on print, or the referral letter can be emailed or sent by fax by selecting the respective options at the bottom, such as clicking on send by email if it is to be emailed, or by clicking on send by fax if it is to be faxed. To save patient care documents outside of the health setting or outside of the clinic, such as referral letters from other doctors, external reports, click on the or select the document tab. This document tab is provided for uploading documents such as blood test reports, etc. Select the document tabs, click on upload to upload documents, select the document, click open, file uploaded successfully. It will show the name of the uploaded file, the date of the upload, and a link to view the file or the uploaded report. Click on view to view the uploaded report. So in this case, we have, for this demo, uploaded a sample blood test report. So these are the main tabs or the main sections in patient chart wherein his clinical information is saved. Now to get a complete clinical summary of the entire patient details saved or recorded, select the close consultation tab just above the tab list in the patient chart. Click on close consultation. We'll open the close consultation window. Select the checkout date by clicking on the calendar icon in the checkout date box. Select the discharge reason from the drop down menu. Discharge summary can be entered in free text format, can be typed in. To get a clinical summary, click on clinical summary, and to close the consultation, click on record to close consultation for this current visit. To get the entire clinical summary, again select close consultation, click on clinical summary. The entire clinical summary gets created in MURX with all the findings recorded or saved during this particular visit, such as the encounter ID, the chief complaints, findings, the examinations and their findings, the vitals recorded, the active medications, their frequency, dosage, completed orders, if any, lab test results, if any completed, if any future scheduled tests are there, future appointments. To save the clinical summary, click on Save. To print clinical summary, click on Print. It will open the new window. It shows the clinical summary document. With the entire case history or the clinical history or findings recorded during this particular visit. So medications, completed orders, lab results. To print this clinical summary, select print or select download to download the clinical summary. So the consultation is closed for this particular visit. After we selected record, this visit will be closed. This is the MURX doctor module. Thank you very much.